Dr. Edward Lanieski, board-certified orthopedic surgeon here at the Orthobiologic Institute seminar in Chicago at McCormick Place. This is the 10th one, and we are asking some of the foremost experts in cell therapy about their opinions on what is the single most important issue in cell therapy today and their ideas to fix that. So I am honored here today that we have Dr. Guillermo, who is from the University of Malaga. It took me about 3 or 4 times to get that, and it's in the southern part of Spain. And he's been using platelet-rich plasma with his patients for a lot of different issues, such as tendinopathies, or that's a tendinitis. He's been using it for sports medicine because that is your expertise. And I can just get right to the question here. What do you think is the most important issue in cell therapy right now?
Well, regarding the evidence of using PRP and soft tissue injuries and joint injuries, I think all of us, we know there is a mainly well-proven effect of an anti-inflammatory effect. But actually, we want to go further away, and we want to see exactly if it's promoting some kind of regeneration, for example, in terms of a cartilage ingrowth. Okay. Mm-hmm. So that's one of the main topics that we should demonstrate it in the next few years, because actually many of the papers that you can read it on published literature, the MRI signs previous and after injection of PRP doesn't demonstrate a really increase of thickness of the cartilage.
Yes.
Instead, there is a good result in function and pain relief. Okay. So that's regarding the joints. If we move to the other tissue, soft tissue injuries like tendinopathy or muscle injuries, yes. There is less evidence in muscle injuries in terms of less recurrence rates. Yes. Or really, there is not so much evidence in terms that you can short the return to play time. Huh? In tendinopathy, it's a really tricky condition to treat in general, not only with PRP. It's a really tricky condition to treat. So I don't know exactly which is the way of treating tendons using PRP, because when you read all the published paper, there is no consensus on the way of injecting the PRP. If it's inside the tendon, outside the tendon, if you are injecting the fat pad or the bursa. So that's really...
And the hydrodissection.
Hydrodissection, yes. Exactly.
Yeah. So, and maybe that's because not all tendons, just like not all joints, are the same, and they serve a different purpose, and for each different purpose there's a different pathology. Exactly. And we have to, I think, figure out what the pathology is, because if you don't know what the pathology is, it's really hard to treat the pathology. And we've been trying to use kind of like a shotgun approach with like drugs and steroids and stretching and rest in hopes of curing it, but we're not really identifying the true pathology. So I think that's a key thing, because not all tendinopathy is the same. Exactly. Just like no patients are the same. And that's why I think some of the studies about PRP, although some of them are very promising, it's not universal. Not all tendons are going to respond the same. So I think that's a really good point. And what would you suggest as a key aspect that we should focus on to help solve that issue? To solve that issue of that there's different types of tendon problems that we truly don't understand, and then figuring out the best treatment for each one.
I would like to focus on tendinopathy problems. So as you mentioned now, it's not the same upper limb tendons or lower limb tendons, because there is different kind of loading.
Yes.
It's not the same. The mid portion of the tendon or the insertional area of the tendon is not the same problem. So first of all, I think we should take into account a specific protocol depending on the imaging and the clinical signs in terms of how much pain is suffering the athlete or the patient. Okay. So if we don't know our own protocols, or we don't reproduce the same protocols always we treat the patient, it's difficult to standardize what we are doing. No? At the same time, we should standardize the system we're using, because you can read many papers using different systems, different volumes, obviously different number of platelets, if it's activated or not activated before injecting, how many sessions of injections, which is the period of time between each injection. So this is really can be really very variable. Okay. And what to do after when you do injection? Do you promote the patient to load the tendon or just rest? It's the same if you have a partial tear or you don't have a partial tear. You should apply loading or you should rest for a period of time. So it's really difficult.
So basically, we need like a recipe card for each problem, but we have to identify that problem correctly.
We need a recipe and see what happens, and then collecting data. And after collecting data, so we can move into one direction or another direction. But the problem is that we need more data. As a clinician, we have many times problem to collect data. So we only be focused on the daily activity, you know. And I think we need to collect more data than we do actually.
Almost every single person that we've talked to here, that has been their answer about collecting more data, and that's why we're here together to kind of look at the data that we need to collect, hopefully collaborate, and maybe we can collaborate with you about getting that data so that we can move this forward, because it's a simple treatment. It's something that can help patients with very little side effects to it, but we've got to make sure we're giving them the right thing for the right problem. So Guillermo, it's been a pleasure.
Me too.
I hope that someday we'll be able to meet you, maybe in the very south of Spain there. I do have one other question for you. And my son would probably not let me leave unless I ask you this question. Who is the best football player in all of Spain?
Playing in Spain?
Playing in Spain, right.
I think playing in Spain, Messi is the best player.
There you go.
Yeah.
That's his favorite.
Sure,
That's
sure.
his favorite. So it is Messi.
Okay.
So remember, these are your cells for your healing. God bless you.